Have you ever seen a person walking unsteadily, as if they were drunk without having consumed alcohol? That's not just clumsiness, it could be ataxia. In today's video, we'll understand what ataxia is, what causes it, how it affects the body, and how medical science manages this condition effectively. Ataxia is a neurological sign characterized by a lack of coordination of voluntary muscle movements. The term comes from the Greek word ataxis, meaning without order. It is not a disease itself, but a symptom of an underlying neurological or systemic disorder, often involving the cerebellum, sensory pathways, or vestibular system. To understand ataxia, we must first know what normal coordination requires. 1. Agility, ability to perform quick alternating movements. 2. Accuracy, precision and control of movement. 3. Balance, maintenance of equilibrium during motion or rest. 4. Timing, correct sequencing and rhythm of muscle action. 5. Smoothness, fluid, non-jerky motion. Ataxia can be classified according to the site of lesion. 1. Cerebellar ataxia. Results from damage to the cerebellum or its connections. Signs: intention tremor, dysmetria, hypotonia, and a wide-based gait. 2. Sensory ataxia, caused by loss of proprioceptive input from dorsal columns or peripheral nerves. The patient depends heavily on visual input. Romberg's test is positive. 3. Vestibular ataxia arises from disturbances in the vestibular system. Features: vertigo, nystagmus, and tendency to fall to one side. Common causes of ataxia include both acquired and hereditary conditions, such as cerebellar stroke or tumor, multiple sclerosis, alcohol or drug intoxication, head trauma, vitamin B12 or E deficiency, hypothyroidism, genetic ataxias like Friedreich's, or spinocerebellar ataxia phenytoin or chemotherapy toxicity. The cerebellum fine-tunes voluntary movement by comparing intended and actual performance through sensory feedback. Damage to the cerebellum or its pathways interrupts this feedback loop, leading to inaccurate, jerky, and uncoordinated muscle activity, the hallmark of ataxia. Typical clinical features include dysmetria, inability to judge distance or range of movement; dysdiadochokinesia, inability to perform rapid, alternating movements; intention, tremor, appears during voluntary action; hypotonia, reduced muscle tone; rebound, phenomenon, overshooting when resistance is suddenly removed; gait ataxia, broad-based, unsteady walking; dysarthria, scanning or slurred speech; nystagmus, repetitive involuntary eye movement. Diagnosis includes thorough clinical and neurological examination, supported by investigations like MRI or CT scan of the brain, blood tests for vitamin levels, thyroid, and autoimmune markers, genetic testing for hereditary forms, nerve conduction studies, Romberg's, finger-to-nose, and heel-to-shin tests. Medical management of ataxia depends on the underlying cause. Let's look at the key approaches. A. Causal treatment. 1. Vitamin supplementation, vitamin E, B12, or thiamine in deficiency-related ataxia. 2. Drug-induced ataxia. Discontinue or replace the offending drugs such as phenytoin, carbamazepine, or lithium. 3. Infective or autoimmune causes. Use of antibiotics, antivirals, corticosteroids, or immunosuppressants as appropriate. 4. Tumor or stroke, surgical removal, radiotherapy, or antiplatelet therapy as indicated. 5. Hypothyroidism, thyroid hormone replacement. B. Symptomatic management, amantadine or riluzole may reduce some cerebellar symptoms. Baclofen, clonazepam, or propranolol for tremors and spasticity. Anticonvulsants if seizures coexist. Speech therapy for dysarthria and swallowing issues. Occupational therapy for improving fine motor tasks and ADLs. C. Genetic and progressive ataxias. No definitive cure yet, but gene therapy and stem cell therapy are under research. Supportive care focuses on maintaining independence and preventing complications. Physiotherapy plays a vital role in maximizing function and preventing falls. Here's a systematic approach. A. Assessment gait, balance, coordination tests. Functional Independence Measure. FIM. Berg Balance. Scale. B. Treatment goals. Improve stability and coordination. Enhance postural control. Reduce risk of falls. Improve quality of life. The prognosis of ataxia depends on its cause. Reversible causes like vitamin deficiency or drug toxicity often show good recovery. Progressive genetic ataxias usually worsen over time, but symptomatic and supportive treatments can significantly improve quality of life. Ataxia may cause major balance and coordination issues, but with early diagnosis, proper medical management, and supportive therapies, patients can live active, fulfilling lives. If you found this video helpful, don't forget to like, share, and subscribe for more medical and physiotherapy learning videos. Thank you for watching.